Hi, I'm Mallory Earley, a Senior Risk Resource Advisor at ProAssurance. Many parents are refusing vaccinations for their children, and that issue is affecting pediatric practices as well as other specialties that treat pediatric patients. I wanted to discuss some of the tips for those physicians and practices that are currently facing this dilemma. Many practices ask the question, must I allow unvaccinated children to be patients of the practice? Here are a few things to consider. First, why are the parents refusing to have their children vaccinated? Many parents fear that vaccinations could hurt more than help their children based on claims that there's a link between certain vaccinations and autism. Also, vaccine-preventable diseases are so rare, many parents don't understand that vaccinations really do work. With more vaccines available now than when many parents were children, there's also a concern that children are receiving too many vaccinations. Groups such as the American Academy of Pediatrics do not recommend practices refuse to treat unvaccinated children. However, there are no laws requiring physicians or physician practices to accept unvaccinated patients in their practice. If the practice chooses not to accept these patients, they should apply such a policy consistently to avoid any allegations of illegal discrimination. So what should you do? First, talk to the parents. Research the facts. Both the American Academy of Pediatrics and the Centers for Disease Control have helpful information. Listen and empathize with their concerns and solicit questions from the parents. Help the parents understand the responsibilities that come with refusal of vaccinations, such as notifying healthcare providers and caregivers when a child is sick, keeping the child out of school or otherwise isolated for long periods of time, and maintaining updated copies of the child's medical records. Continue the conversations as necessary. Each practice should determine whether or not the risk of spreading preventable diseases outweighs the risks of leaving untreated children in the community.